So hello everyone, and let's start with the third case of this Osce series. So here we have a 10 weeks old infant with a small round bluish left medial canthus mass which was identified shortly after birth, along with a distal intranasal cystic lesion causing nasal obstruction. So there were two masses, one in the medial canthus of the left eye and an intranasal mass which was seen. And there was excessive tearing with crusting in the left medial canthus, and these are the MRI pictures done for this patient. So here we can see medially, in the medial canthus there is a cystic mass lesion with fluid level on these axial T2 weighted images. These are the coronal T2 weighted images where again we can see a dilated tract along with this intranasal extension of this tract from the medial canthus. So what do you think the diagnosis is in this case? Mass in the medial canthus, a mass which is there within the nasal cavity, and there is complete dilatation of the tract from the medial canthus of the eye to the nasal region, and there is excessive tearing, history of excessive tearing that is present. So this is the picture of the child. We can see this medial canthus mass very well. So what are the findings and the diagnosis? What is the radiological triad and what is the complication of this particular condition? So this is actually medial canthus cyst, which represents enlarged lacrimal sac which appears in continuity with enlarged nasolacrimal duct. The enlarged osseous nasolacrimal canal secondary to an enlarged soft tissue nasolacrimal duct is also present, and the intranasal cystic mass represents the inferior extension of the mucocele. So it's actually a nasolacrimal duct mucocele which represents cystic dilatation of the nasolacrimal apparatus secondary to distal obstruction of the nasolacrimal duct by valves of Hassner. So the radiological triad in this particular case includes a medial canthus mass that represents the enlarged lacrimal sac, an enlarged osseous nasolacrimal canal secondary to the enlarged soft tissue nasolacrimal duct, and an intranasal cystic mass which represents the inferior extension of the mucocele. So this is the radiological triad which is very important to diagnose a nasolacrimal duct. So a complication of nasolacrimal duct mucocele is infection, and that is particularly preseptal cellulitis. That is, the preseptal compartment is inflamed here. We can see this particular fluid collection and fat stranding that is seen, the preseptal cellulitis.